Hi, good afternoon, and welcome to our fourth Facebook Live. I'm Dr. Larry Seidman,
Hello, I'm Dr. Alifiya Tyabji.
and we're the doctors of Nova Pediatrics. Today we're going to talk about returning to normalcy, the ways to cope during COVID during the summertime. So thank you for joining us.
Thank you for joining us today. So some of the topics we'll be going over, we'll briefly be discussing how to continue talking with your children about the coronavirus crisis, especially with the upcoming summer, getting families, children, teenagers outside of your home while continuing to do those social distancing practices. Keeping your children healthy and safe this summer, we're going to be going over some tips to prevent accidents and injuries, and then discussing upcoming summer plans that families may have, and then what is new at Nova Pediatrics.
Right. So talking to your kids about the coronavirus, we did have our first Facebook Live about that, so please, all these videos are available for you looking after the talk. So first thing is to welcome their questions, encourage them to ask, and whatever the question may be, try to take your child's concern seriously. Your goal is to help your children be heard and get fact-based information that's likely to be more reassuring than what they're hearing from their friends and on the news. And speaking of the news, we talked about this, taking a break. Recommend to not have the news on around your children.
Absolutely. You also want to speak to your child at an appropriate developmental level, but always be honest and clear. And even if you don't have an answer, just be comfortable with saying, I don't know, and be reassuring, especially during this time as the state's going to be reopening and with summer plans possibly changing. We also want to continue that communication and make sure that your child's involved in those plans.
And what's right for you and your family may not be the same level of concern or anxiety as another family. So we try to take the middle ground. What would a reasonable person do returning to a sense of normalcy during the summer?
And as you were talking with your family members and your children, we all have a sense of the unknown, possible, anxiety and stress in your life from different factors. So it's important when you are talking to your children that you are taking that time to first be relaxed and calm before approaching them.
And be developmentally appropriate. Don't volunteer too much information, more than they can handle, and take some cues from your kids. Invite them to tell you what's going on in their life and what they've heard about the coronavirus and how they feel. So your goal is to really try to avoid any frightening fantasies that they might have had, some bad dreams or heard from some friends, and so just try to maintain calm with your spouse and be a team. As parents. One of you may be more concerned than the other, but meet together separately, not in front of the kids, and be a team so you can be unified for what's right for our family might not be right for the neighbor's family.
Absolutely. And then to focus on what you're doing to stay safe during this time. Again, reassuring and emphasizing with your children the safety precautions that you as a family are doing in your household. In particular, hand washing, using hand sanitizer, and then developing a plan when you do go out into those public spaces and explaining what are the safe and unsafe areas, and wearing masks. If you have young infants and toddlers, maybe having them in a carrier or a stroller. There's just some ways, to keep them safe as well. And just keep that conversation going because, day to day, things are changing. And we want to make sure that that open line of communication is there.
And a child may not be able to differentiate a safe from an unsafe zone. So Mommy, why do I have to wear my mask when we're, going into the store, but I don't have to wear it at home? So just differentiating what's safe, what's not safe, and the kids can really come around with that consistency.
Absolutely.
So getting your children and teens outside while social distancing during this time period.
Well, the summer's coming, the weather's going to be beautiful, and we want everyone to be outdoors.
So some of the tips are nature's all around, all the flowers are blooming, all the trees are blooming. So getting out, taking a walk, taking a bike ride, planting a garden so kids can actually see where their vegetables come from, bringing out your baby in a stroller ride. It's perfectly fine to take a toddler or a child around in the neighborhood to get outside, get some air.
As Dr. Seidman mentioned, taking walks and bike rides, even with non-household members, are appropriate as long as you're keeping that physical distancing. And to continue exploring nature, even with younger toddlers and children, you can do so many creative things by building things, doing nature scavenger hunts. I know my children love drawing with chalk on the sidewalk. You can do rock painting, planting a garden, and even with the older teenagers and children, they can keep nature journals. There are so many wonderful things, and you definitely want to encourage taking advantage of this.
Exactly. So some of the things you mentioned, keeping a nature journal, tossing a ball, a frisbee, all those things would be fine outside. I think that we can really see a lot of physical benefits from being outside. There's a lot of the tension that kids are feeling, being claustrophobic, being inside the house. I think that decreases the level of stress. It also helps them to be more engaged for doing their school learning. And you could make some learning happen outside.
Absolutely.
The curiosity of nature and creativity and critical thinking.
Absolutely. I think for everyone, we'll just be physically and mentally healthier.
Yes, absolutely. So keeping kids healthy and safe this summer, we have to realize that the summer is coming, and there are things that we could help to keep your kids safe regarding the sun and pool and bicycle safety. So just to keep in mind, all those things are going to be happening now. So we're also going to touch on some of the things to do with the summer camps might be canceled, the pools might be canceled. So how do you book a vacation this summer and get out? So maybe think about an RV or renting a vacation house, avoiding flying if possible.
And our goal is, for our families to enjoy this summer, but to provide some tips to keep your children safe and to prevent accidents and injuries and trips to the urgent care and the emergency rooms. So the first thing is, is the sun safety. The most important thing with that is to prevent sunburns, which are unpleasant, painful, and can actually, cause damage to your skin. And it's important to use that SPF of higher than 15 for your sunscreen, to continue to reapply every 2 hours, and after coming out of the pool, after swimming, or after sweating. So it's extremely important to prevent those sunburns from happening, along with hydration. When you're going to be outdoors, hydration is extremely important. Primary, source of hydration is water, and we also want to prevent the dizziness, passing out, and heat strokes from happening.
If you see your kids getting really red in the face, that's a sign that they could be getting overheated. So still wearing a hat with a brim, keeping under the shade, trying to minimize being out around that noonday sun when the sun is really the most powerful.
Yeah, between noon to 4 is when the UV rays are the most powerful. So water safety. So as Dr. Seidman mentioned, many pools may be closed. Private pools may be open, but they may have policies in place. So, we'll just have to wait and see what happens. And you may have home pools, but the most important thing is to always still remember that water safety tips. Never leave your child unattended. Depending on the swim skill level of your child, having them wear, appropriate life vest or puddle jumper. And if you do have a home pool, to make sure that it is surrounded by at least a 4-foot high fence that's non-climbable by your child, that it's self-locking and self-latching. The most important thing is safety, and drowning is a leading cause of death among children, and we obviously want to prevent that from happening. Learning CPR is a good tool if you do have your own pool.
Absolutely. Bike safety tips. I see the kids out now, and a lot aren't wearing helmets. So I think just if your child is a little bit older and is a leader, then the younger kids see them, that they're wearing their helmet when they have a scooter, when they have a bike, that the two go together, anything with wheels. And so we want to avoid those ER trips as much as possible.
And make sure that's an appropriate sized helmet as well, and that they're wearing it properly.
Another thing we've been seeing in the office is ticks. So with kids being outside, in the woods, in the high grass, ticks really are very much out there now. They don't fly, they crawl, and they'll jump on you from usually from the ground level, around your ankles, can crawl up inside the pants. So really wearing appropriate protective clothing. If you're going to be out in the woods, just tuck your pants in the socks. Use the
also tucking your shirt into your pants as well.
Into the pants, and then using the DEET, D-E-E-T, is still the most effective repellent for mosquitoes as well as ticks.
And you can even, think about, treating your clothing and gear with permethrin as well for protection. But, on a day-to-day basis, to avoid those tick-infested areas, so, to be outdoors and to go hiking and walking on trails, you want to stay, on those clear paths and avoid going into the woods and and the tall brush. And the other thing to do, again, is to do those daily inspections and those frequent inspections. So that goes along with doing those body checks on your child and yourself after playing outside, but also checking your pets, clothing and gear, and pay special attention to those exposed body parts, such as your head, your neck, behind the ears, and areas of tight clothing, your under your arms, your sock and belt lines. And it's good to do those frequent checks if you're going to be outdoors. And then once you do come indoors, to try to have a bath within 2 hours of coming inside. That way you can locate those ticks, and place any dry clothing in the dryer and high heat. That will help to, kill those unattached ticks on your clothing.
The removal of ticks will be another good video we will put on our website. But call our office if there's any question. Usually if you remove the tick within 24 hours, then it's not going to be able to spread any of the diseases like Lyme disease. So if you do a daily check on your child, that's really important. Sometimes these small deer ticks can be as tiny as a poppy seed. It can look like a freckle. So if the freckle's moving and you see the legs moving, that's a tick. And so using a tweezers, you have to be very patient and pulling that out, trying not to, pull so hard and quickly that you leave the head part in. So
it's important to grasp that tick as close to the skin as possible.
Absolutely.
Be patient, be gentle, as you don't want to squeeze that tick, or, when you're removing that tick, to leave any body parts or mouth parts behind. So you do want to move, very gently and pull straight out without, twisting. And after you do remove that tick, you can clean that area with soap and water. And we're going to have some information posted in our Facebook comments with some good, resourceful links through the Fairfax County with information about ticks, and they also have a tick identification service as well.
Next up is poison ivy. That's something that comes up every summer, and this is an allergy to the urushiol, which is the oil in the shiny green leaves. My mother used to say, leaves of three, let them be, but there's also poison oak, poison sumac. They usually come in odd numbers, 3 or 5 leaves, shiny green, usually growing around the trees. And so if you Google what a poison ivy leaf looks like, that'll be helpful. If you do come in contact with it, there are some new products on the market which are good. They're in a detergent family. One is called Zanfel, Z-A-N-F-E-L, and if you wash your skin where you've been exposed within a few hours after the exposure, it really decreases the amount of the urushiol on the skin.
And helps to heal. It helps for your skin to heal, more quickly as well. So, so what do we do when your child has been exposed to poison ivy? You want to immediately remove and wash their clothing that's been exposed to or touched the poison ivy plant. You want to gently wash your child's skin and scrub under their fingernails right away with soap and water, especially because that skin is going to be itchy. You want to cut their nails because they may tend to scratch their skin. And you want to place those cool compresses on the skin. And then, use some of the product that Dr. Seidman mentioned, with cleansing their, washing their skin. And then to help with the itching. I think itching is the most difficult for the child. It can cause difficulty with them even sleeping. So you can add oatmeal to the bath, calamine lotion, and depending on, how bothersome it is when they're sleeping, sometimes we may suggest, I would recommend calling the pediatrician's office, and we may even suggest, giving Benadryl before bedtime to help them sleep easier at night.
So while most poison ivy is mild, each year that you get it, it gets worse because the body has an amnestic cells, the memory cells, and they're fighting this like a foreign invader. So while poison ivy isn't contagious, you can't catch poison ivy from a friend. It looks pretty bad. Sometimes it could be secondarily infected. So when to call the doctor. So if there's any kind of rash, especially with fever, you should call our office. If you find that it's covering a large part of the body, a child can't sleep, if it's on the face, especially, that's something that we should see the child. We're also doing the telemedicine visits, and many times we can make that assessment that way too.
Absolutely. And again, looking for any sign of an infection, is important as well, and to continually, check your child's skin.
So again, it sometimes looks worse. It isn't contagious. That we get that asked a lot. Can we catch poison ivy? But you can't. And so this is the body's reaction to inflammation. It's an allergic reaction, and it can be delayed for many days, and that's why it looks like it's getting worse over time, because the body's immune response is mounting that delayed hypersensitivity, which can be several days after the exposure.
And so you had touched upon it earlier, but for many families, summer plans have changed. So you will have to, this is a good time to spend time with the family and communicate with your household, but also with non-household members as to how you're going to be spending your summer. Summer camps have closed, but many of them might be doing virtual camps. One suggestion that I know the Cub Scouts and Boy Scouts are doing is camping at your home. And as you had mentioned, looking into getting renting a house or a cabin on the beach or more secluded area. If you have an RV, take advantage of that. But this is the time where we're gonna, be creative, so that way we can all enjoy our summer.
Exactly. So we're approaching the end of our talk, and we just wanted to mention a few of the updates with Nova. And we have our tent that we've been setting up outside our Woodbridge office. And yesterday we did a shot clinic there to help kids keep up to date on their vaccines. It's quick, private, and people can pull their car up and be seen. We plan to be expanding that during the summer months. We're also, you might have heard about the COVID-19 testing. The antigen testing is a quick test in the office, quite similar to the flu test, so stay tuned for that. That should be available within the next few weeks.
In the news right now, you're going to hear a lot about the testing and different types of testing. There is the PCR molecular testing, which is very accurate and it will detect active infection. But there's also another type of test you may have heard of called the antigen testing, which there's many different types out there. But research has shown, and as medical providers at this time, we are not recommending the
antibody testing.
The antibody testing. The antibody testing is what is not accurate and reliable, and it's difficult to interpret those results. And it does not, at this point, we don't know, whether it will show any immunity.
So you might know some of your friends or family that are requesting this. We just don't know how to interpret this IgG or the immunoglobulin levels. So you can see on our page the tent, which we had set up at our Woodbridge location. And so this is right outside the office. It's convenient. You can drive up. It's private. And we have a heater available to keep it at about 70 degrees. Also, we have an overhang that we set up the tent. If it's inclement weather, this is right by our back door. So this is something we're trying to make ourselves available for your needs. And remember, the office is very quiet now. We can get you in quickly, in and out, and this is another way where we're trying to make ourselves available. That's the inside of the tent with one of our nurses there, and this was yesterday when we were doing the shot clinic.
So we want to make sure that we are accessible to our patients, and we want you to feel safe and for you to continue to come in for your physicals and for your vaccinations. And this is one option available to make this a very smooth, comfortable, and still private way for you to be seen.
And we're still open in our office, seeing physicals for those of you going away to college and you need to come in. Now is the time. If sports season should happen in the fall, we're doing also the sports physicals after May 1st for the high school sports. Now is the time. We want to just close by saying that next week, check out our Facebook Live. It's going to be on toddlers and temper tantrums, something to look forward to there.
And we just want to wish everyone a wonderful Memorial Weekend. We want to thank and honor those men and women that died protecting and serving our country in the United States Armed Forces. Thank you so much for listening to our Facebook Live today, and have a good weekend.
Happy Memorial Day. Thank you for watching.